This is Operations Division Chief Joe Rinaldi, and I'm giving you an audio version of the Operations Division update given to the Board of Directors on October 9th of 2008. The first thing I'm going to talk about on this update of the Operations Division is just an overview of the areas of responsibility that fall under the Operations Division. The first is Emergency Operations, Emergency Medical Services, Facilities Maintenance, Fleet Maintenance, Logistics, Administration. So under Emergency Operations, our primary goal in the Operations Division is to respond in a timely manner to the request for help we get through the 911 system. So our response time goal, as it was lined out in the strategic plan, is that the first San Miguel resource would arrive on scene of a Code 3 response in 8 minutes or less 90% of the time. So that's the criteria we're going to use to measure our success. One of the ways that we have done this, and this is a recent program that we've started to use, is called the First Watch program. This is actually a program that's been in existence for several years through the County of San Diego through a Homeland Security grant, and actually all Heartland agencies were participating in it just with all their calls being sent into the First Watch program, but nobody was actually utilizing the information. First Watch actually gives you the ability to take the raw response data and then look at it in different ways to measure different outputs. So what we decided we wanted to measure was our response time performance. If you look at this bar graph on the screen, this actually shows a period of July 1st to September 30th of 2008, and each one of those bars represents daily performance, where the pink areas are outside of our 8-minute response time standard and the green are within the standard. So if you look at that data from the time period I mentioned, July 1st to October 1st, 2008, this is another view of the graph that shows on a daily basis how our performance is, and it goes up and down depending on the time of day, the number of calls, and other factors. But here is the results. Again, this is the first arriving San Miguel unit on a Code 3 response within the San Miguel Fire District. There were 1,801 responses within that time period, and we achieved a 92.3% of making it to those calls in 8 minutes or less. So we actually exceeded our percentile by 2.3%. The next area of emergency operations, and again this is a large portion of what we do, the largest, is emergency medical services. Some of the things that we've done to improve our EMS system: one is we have our internal EMS committee formed by Chief Converse, co-chaired by Jim Marug, and then made up of different employees throughout the organization that are paramedics, in order to improve our internal EMS system. They've adopted a standard medical supply inventory. We have a recommendation and purchase of EMS safety eye protection that should be going out to everybody soon, and providing recommendations to improve the EMS system. So they've been working together on trying to make sure that our internal EMS is as good as possible. We also have the Regional Cooperative Care Program, which is headed by Jim Marug, one of our captains, and Linda Broyles, who are providing quality assurance and quality improvement support on incident exposures, where we have people that are exposed to people with disease or body fluids or those type of things, and also providing a large amount of training and staff support. And the RCCP really is providing an invaluable service to the Operations Division. One, we have a very professional organization that's doing a complete review of all of our EMS calls, are doing all of the to back up one on this. All of the AMAs are being 100% reviewed on incidents. Back up one here. The next big part of emergency operations is the emergency medical services, and this accounts for about 85 or more % of our incidents we respond to in the San Miguel Fire District. One of the things that we've done to improve EMS is we've formed an internal EMS committee. Again, this is part of the strategic plan program and the relationships by objective that we have between management and labor on the committee process in order to get everybody involved in making decisions. And so that committee has done several things. One, they've adopted a standard medical supply inventory, which also interfaces with our station supply program we'll talk about a little bit later, in order to make a standard list of the amount of items and what type of items we'll carry in the stations for EMS. Also, we've had a few calls where we've had people with eye exposures. We've realized the need to have eye protection, so the committee went through, looked at different options for eye protection, and has purchased those and in the process of getting those out to all of our employees and coming up with a policy for when they should be worn. And also they provide recommendations to improve EMS. They look at how we're doing things here and see if there's ways that we can improve our ability to provide EMS and support EMS within the district. Another big part of EMS, and it's actually a great organization that we belong to, is the Regional Cooperative Care Program. And that's run by one of our captains, Jim Marug, and Linda Broyles, who's the nurse that's assigned to the RCCP. The RCCP actually not only serves San Miguel Fire District, but it also serves several city and district fire departments in the local area and provides quality assurance and quality improvement services for review of our EMS performance. It also takes care a lot of the training with the continuing education for EMTs and paramedics. Also, on if we have any kind of exposures of an employee, they'll follow up with the hospitals and the doctors to make sure that our employees are well cared for and that they're aware of any potential issues. And also they provide quite a bit of staff support to the operations division. So the RCCP has been a great benefit to all the departments that participate in it and has really enhanced our EMS program here at San Miguel Fire District. Also, AMR, as being part of the RCCP, is doing a good job of complying with their contractual obligations for Rosemont Hospital District and the member agencies of that Zone 1, which includes San Miguel. And for 2008, their response times were 90 to 92 percentile for San Miguel, and they had 0 exemptions granted. So they had very good performance, and our relationship with AMR has really improved through the RCCP because we have somebody that can go between both agencies and try to deal with any issues that might come up.